Now, South Africa has recorded 60% more excess deaths than expected in the last few weeks compared to previous years. This, of course, is raising questions now about whether the recorded COVID-19 death toll is accurate. To discuss what this means, we're joined by Wits University vaccinology Professor Shabir Madhi. Good evening, Professor. This is a research that came out on Wednesday from the Medical Research Council. 17,000 excess deaths from May to July, compared to data from the past 2 years. Now, there's a couple of options that could suggest we're not recording all our COVID deaths, or it could suggest that these are other deaths. So maybe we're getting more HIV deaths, maybe more TB deaths, because those are being neglected at the moment. What do you think it is?
Yes, good evening, Sally. So, Sally, I think it's actually a hybrid of the two, in that there is underreporting of COVID-19 deaths, and that wouldn't be surprising because that wouldn't be unique to South Africa. The same has happened in the United Kingdom, in Italy, in Spain, in the United States. There is systematic underreporting of COVID-19 deaths because some people, unfortunately, simply don't get to a hospital before their demise. And others might get to a hospital, but they might not be tested because it might not be suspected they've got COVID-19, but the death might be due to COVID-19. So there is underreporting of COVID-19 deaths. But in addition to that, I think it's a combination in that there is probably an excess in terms of mortality from non-COVID related deaths. You cited TB and HIV, but other conditions, including heart problems. So in the United States, as an example, they've seen an increase in terms of deaths from cardiac arrest, from myocardial infarcts, which are not necessarily related to COVID. So I think it's a combination of those two that's contributing to the excess mortality that we're seeing and the discrepancy that we're seeing between the deaths that are reported as COVID-19, which are confirmed COVID-19 deaths, and those that are not actually being diagnosed.
The other big issue this week, of course, was the news last night that schools are going to close for a month to get us through the peak. The President telling us that the WHO basically makes this recommendation that if infections are rising, we should consider closing down the schools. So is this a win for science?
Well, I think WHO makes recommendations, but the implementation of those recommendations are dependent on a specific context. And certainly if that was the reason we're closing schools now, then we shouldn't have opened schools to start off with after we shut it down in the initial period during level 5. So, no, it's not. I mean, there's a number of factors that's influencing this decision. In terms of the science of it, the College of Medicine of South Africa, the public health specialists in the college, as well as the South African Pediatric Association, and many of the members on MAC simply had stated that schools should not be shut. Because if anything, there's a threat that it actually poses more harm to children than good. So in a South African context, there's very little reason for schools to be shut at this point. And the notion that you're shutting schools for a month and that the wave is going to have passed and a peak is going to be passed, unfortunately, it's a misconception because, as the Minister of Health himself said, South Africa, for most part of the country, for many of the provinces, will only probably start peaking at the end of August and beginning of September, which is exactly when we're planning to reopen the schools. So certainly that's not the reason. And what influenced the decision is unknown to me. But certainly as a scientist and as other scientists in the country, I think a number of them have written opinion pieces indicating the harm that schools are going to be caused by closing schools once again.
The other issue that's really been in the headlines this week is the issue of the alcohol ban. There was a tweet, an incorrect tweet, saying that the alcohol and the tobacco sales ban will stay in effect for the lockdown. That was quickly corrected by government, but it seems it was off a working document. What does the science say about, we know for a fact that since the sale of alcohol was stopped, there has been an easing of pressure in our hospitals. Is it something that should be targeted for perhaps the period of the lockdown, maybe for a month or two, or is it something that should be considered for months and months and months to come?
Sure. So exactly the same report, the South African Medical Research Council report, basically showed that during the phase when there was a ban on alcohol, there was a substantial reduction in terms of deaths from trauma and violence. And some of that is possibly attributed to alcohol abuse. So the whole issue of alcohol abuse is separate from the ban on alcohol, and it's about responsible behavior when it comes to alcohol usage. There can be restrictions that are imposed, which allows people to be much more measured in terms of the manner in which they go about using alcohol. Whether an outright ban is going to assist, the answer to that is possibly not, because people are still brewing beers illegally, as an example, and they're probably doing that in groups, which itself lends to an increase in terms of possibility of transmission. So the reason why the alcohol ban is being put in place is different from the reason why the smoking ban was actually proposed. But in terms of whether it's going to work, it certainly has relieved the pressure in terms of trauma that is being admitted that's needing to be dealt with in the hospitals. Is that going to be enough to free up resources to deal with COVID-19? No one really knows right now.
And some new research coming from King's College this week, I think, and it's talking about how early symptoms can be an indicator for what's going to happen later down the line with your COVID-19 infection. Also some talk that now we're starting to see different clusters and different, sort of 6 different clusters of how the disease actually manifests itself. Is this suggesting that this virus is a lot more complicated than we anticipated?
So not really. So basically what they did in that particular sort of analysis is they sort of developed an algorithm looking at different clinical manifestations and what the outcome of individuals were. And not surprisingly, the type of symptoms which suggest that there is infection of the lungs or there's some sort of pathology occurring in the lung, which is basically chest pains and shortness of breath, together with, as an example of a fever, would predict poorer outcomes. So it doesn't come as a complete surprise. All they've done is they've taken the known signs and symptoms of COVID-19 and they've been able to play around with it in a sense and come up with sort of different groups, which predicts which individuals are more likely to have a severe disease, end up in hospital, as well as possibly die.
What about the long-term impact of COVID-19? And we hear lots of stories of blood clots that people are still battling within the lungs and in other parts of the body. Are we learning more and more about the long-term impact, and is it more serious than we anticipated?
So certainly I think for those individuals that are unfortunate enough to experience severe disease and essentially end up in hospital and recover from that hospitalization, they certainly seem to have sequelae that persist for a measurable period of time beyond their discharge from hospital. And much of it obviously has got to do with the healing of the body. And as you mentioned, what we now pretty much accept is that it causes inflammation in many organs, including the lung, including the heart, including the brain. And the damage that results in those organs takes time to heal. So it doesn't come too much, I mean, it comes as a surprise that this virus has been so virulent in terms of the damage it causes, compared to, as an example, seasonal influenza, which doesn't inflict the same sort of sequelae. So I think we've learned more, and certainly, unfortunately, for those individuals, especially those that end up in hospital, there seems to be a much longer road to recovery than we would wish for.
And let's just be clear, because that just puts the fear of death into all of us to hear that and makes us think that we should never reopen our schools again. It is a small percentage of people who end up in hospital. What is it in South Africa at the moment, roughly?
So I think in terms of children, it's like 0.01%. It's nominal. 4 out of every 5 children that are infected with the virus won't even know that they've been infected. They'll be completely asymptomatic. Amongst adults, it's roughly about 5% of adults that will probably end up in hospital, 5% of adults that are infected with the virus. Even amongst adults, roughly about 2 out of every 3 adults will be completely asymptomatic. And of those that become symptomatic, the majority of them would have mild symptoms, or at least they wouldn't require hospitalization. So it's roughly about 5% of adults that unfortunately would end up in hospital, and they unfortunately would experience some sequelae post-discharge as well.
Well, thank you very much for your time this evening, Professor Shabir Madhi from Wits University.